Afternoon, boomers. Brian Tong here from Boomerlife. Today I'm talking about early cancer symptoms. Um, my parents and my sister all died of cancer, and there were signs long before there was diagnosis in all three of them. Early cancer symptoms should be in everyone's awareness. Cancer treatment has come a long way, but early diagnosis remains the best chance for survival. The human body is made so that it sends us signals as symptoms to let us know something's wrong. Sadly, many of us overlook such signs, thinking it'll be all right anyway, or maybe you're afraid to look into something for fear of what you might find out. Also, in an effort to stay safe from COVID, many people have avoided regular checkups and annual screenings. So, the following are some symptoms which may or may not indicate a problem, but all are worth discussing with your doctor. So go to my blog at boomerlife.net and you can read it. And I've got some pictures. The first one is a persistent sore throat. This may signal throat cancer, which is sometimes indicated by other symptoms such as difficulty breathing or swallowing, or a lump in the neck or the throat, prolonged hoarseness of speech, coughing up blood, or persistent foul breath. These conditions could also have other causes, but should not be ignored. Consult your doctor and get an exam. If you feel as though food is getting stuck in your throat and you have trouble swallowing for more than a few weeks, this too can be a sign of throat, lung, or stomach cancer. A lump in the neck could be an infection, but it's also an early warning of mouth, throat, thyroid, and voice box larynx cancers. Cancer lumps usually don't hurt, so if you have one that doesn't go away or grows, see your doctor. Abnormal periods or pelvic pain. Most women have occasional irregular periods or cramps, but persistent pain or changes in your cycle can be a sign of cervical, uterine, or ovarian cancer, which is what killed my mother. So look into it if that happens. Changes in bathroom habits. Significant changes in bodily function can indicate colon, prostate, or bladder cancer, among others. Warning signs include persistent constipation or diarrhea, one extreme or the other. Black or red blood in your stool, black tarry stools, not sure what that is, or more frequent urination and blood in your urine. Check it out. Bloating. We all feel bloated now and then, but bloating for more than 2 weeks can be a sign of ovarian cancer as well as various gastrointestinal cancers. Breast changes. These include a new lump, dimpling, discoloring, or changes around the nipple, or an unusual discharge that you didn't have before. While most breast cancers occur in women, men can develop them as well. Chronic coughing. A cough that persists for more than 2 weeks, especially a dry cough, can be a sign of lung cancer. A cold or the flu can make you hack away, but it's also a potential symptom of lung cancer, along with red flags like chest pain, weight loss, hoarseness, fatigue, and shortness of breath. See your doctor if you can't seem to shake it, especially if you're a smoker. Chronic headache. A headache that lasts more than 2 weeks and doesn't respond to the usual medication like aspirin can be caused by a brain tumor, a brain bleed, or stroke. Have this checked out by your doctor. Excessive bruising. A bruise on the shin from bumping into the coffee table is normal, but suddenly getting a lot of bruises on unusual places that haven't been bumped can indicate various blood cancers. Frequent fevers or infections. Spiking fever over and over, or going from one infection to the next, can indicate an immune system that's been rendered more susceptible by leukemia or lymphoma. A fever that doesn't go away is a sign of an infection, but some cancers, including lymphoma, leukemia, and kidney and liver cancers, can also make that happen. Cancer fevers often rise and fall during the day, and sometimes they peak at the same time. See your doctor if you have a temperature of over 100.5 degrees that lasts for more than a few days. Persistent sores or lesions or painful areas in the mouth, especially in people who smoke or drink heavily, can indicate various oral cancers. Skin changes. I've got a little mole on top of my head I'm getting a little concerned about. A shift in the appearance of a mole or birthmark should be assessed by a healthcare provider, either in person or through a video visit. Remember which changes are cause for concern to use this mnemonic. ABCDE. Asymmetry. where one half of the mole or mark doesn't look like the other, or it has an oddly shaped border, borders that are irregular or blurred, color that varies, changes, or is inconsistent, both black and brown, diameter, it's larger than the size of a pencil eraser, and evolving. This means any mole that grows, bleeds, or otherwise changes over time, or it crusts or scabs over and doesn't heal. I put some pictures in the blog. Pain that lasts. Persistent pain anywhere in your body that has no clear cause and doesn't respond to standard treatment should be evaluated, especially if it's in the stomach area. Persistent fatigue. A sudden lasting change in your energy level, no matter how much sleep you've been getting, can be a sign of blood cancer or leukemia. Extreme fatigue is one of the most common cancer symptoms. We're not talking about a normal type of tiredness here. It's exhaustion that doesn't go away. If changing your activity level or getting more sleep doesn't make you perk up, see a doctor. Postmenopausal bleeding or blood in the urine or semen. Cancers can bleed, but so can a bunch of other things like ulcers, hemorrhoids, infections, or sores. When you see red in your poop, the blood is often from somewhere in your GI tract, meaning your esophagus, stomach, or intestines. One way to tell where the blood is coming from is how light or dark it looks. Bright red could mean the bleeding is in your rectum or the end of your intestines. A darker color means it may be from higher up, like a stomach ulcer. No matter what the cause, blood in your stool is an early cancer symptom that needs to be checked out. You may need a colonoscopy or other tests to find the problem. Same with blood in the urine. When it shows up in your pee, it could be a warning sign of a problem in your urinary tract or kidney or bladder. A pink, brown, or red tinge to your pee or semen is usually nothing to panic over. Infections, kidney stones, injuries, and non-cancerous prostate growth can all cause bleeding. Less often, bladder or prostate cancer might be to blame. Your doctor can do urine tests and other exams to find the source of the blood. Stomach pain or nausea. Unusual discomfort that lasts more than 2 weeks can be a sign of liver, pancreas, or various digestive system cancers. This is what killed my sister, was pancreatic cancer, and she had pain in her stomach for months, and they couldn't figure out what it was. By the time we got her to the Mayo Clinic, it was too late. Early cancer symptoms sometimes even baffle health professionals, so if you have them, persist in getting an accurate diagnosis. Unexplained weight loss. Boy, wouldn't I like to have some unexplained weight loss. Some explained weight loss, preferably, because I've been dieting forever. Weight fluctuates. Unfortunately, mine only seems to fluctuate in the up direction. But the loss of pounds when you're not trying, or the loss of appetite, never had that problem, may indicate types of cancers, especially ones that have spread. Many conditions from depression to the flu can make you feel less hungry. Must be 3 o'clock. Cancer can have this effect by changing your metabolism, the way your body turns food into energy. Unusual lumps or mass. Any unusual new lumps or mass that don't go away should be evaluated. Lymph nodes often become swollen when you have a cold, but if the swelling persists after you're well, you should contact your doctor. So that's it for this stuff. I'd like to remind you that this blog is for educational purposes and is not intended to replace the advice of your doctor or other healthcare provider. We encourage you to provide discussion of any of these questions or concerns you have with your provider. While I did sleep in a Holiday Inn suite once, I am not a medical doctor. And that's all I have for you today. Boomers, have a good one. Brian Tong, Boomerlife out.